one illness sure to knock many Canadians off their feet this winter, the flu. But did you know there's a needle-less option to getting the flu shot?
It's a nasal spray, and it's been approved for use by Health Canada since 2010. The trouble is it is not covered by OHIP. Genevieve Tomney has been looking into this. She joins us live in studio. So, Jen, why is OHIP not covering it?
It's a good question, and that's exactly what we asked the Ministry of Health, given there's a lot of strong evidence, including some research done in this province, suggesting flu mist is the better option for kids.
It's the little jab that protects from the flu, but for parents, getting your child to get the shot can be a challenge.
Because a needle is always like a big pain, especially the smaller they are, the harder it is. Now she's in that age where she's realizing something is happening, so there will be tears.
There is another option. In Canada, a nasal spray vaccine called Flu Mist has been approved since 2010, an option studies show works even better than the traditional shot in children aged 2 to 17.
It is more effective. It prevents the flu better than does the flu shot in that particular age group.
Trouble is, unlike the flu shot, in Ontario you have to pay for Flu Mist, anywhere from $25 to $30. Over the last 4 years, CBC News has learned most provincial and territorial health plans across the country have started to fund Flu Mist. In fact, Canada's National Advisory Committee on Immunization recommends it over the flu shot for children over 2. Still, Ontario hasn't signed on. In a statement, a spokesperson for the health minister says the ministry is currently reviewing new flu vaccines, including Flu Mist, looking at scientific evidence, cost effectiveness, and impact on the health system. But there is some pressure on Ontario to catch up.
We found 10 schools that were willing to participate, and we assigned 5 of them to get the Flu Mist, and then 5 of them to get the regular flu shots.
Flu Mist quadrivalent.
Public Health Ontario has already studied Flu Mist and found it was both a feasible option and one that did better protect kids.
Hopefully that's the idea, is that we can inform the policymakers so that they can make a more educated decision about which vaccine should be funded. And so hopefully this will help people who are making the decisions to make those decisions.
Now, one thing that researcher does point out is that Flu Mist is a more expensive vaccine than the regular flu shot, which could be a consideration for this government given Ontario's size.
So if someone, maybe Dwight, wants to get Flu Mist, can they get it here in Ontario, even though it's not covered?
Absolutely. It is technically available in Ontario, but because it's not funded under the provincial health plan, you have to get a prescription and you'll have to pay for it. And Dwight, it is safe to use for ages 2 to 59. So even if you are an adult who has a bit of a needle phobia, it is an option if you want to pay.
Yes, thank you for that, Jen. And yes, I do have a bit of a needle phobia.